I asked the pharmaceutical audience very recently, about half an hour ago, whether if they were in charge of their own companies and could put their efforts behind a single initiative, whether they would focus on this patient-centric argument or whether they would focus on things like data. And the reason why I asked about data is because exactly of Richard Bergstrom and his opinion that this is the area where the companies most need to catch up and have the biggest opportunity. So would you say at the moment that the industry is slightly skewed in its focus?
I think the challenge to the pharmaceutical companies is that they believe that the capture of the data is going to be easy. Every meeting I've attended, they have been so enthusiastic and can see the great need for this, the benefit of it, and they believe it'll be easy. I think it will be quite difficult. People are extraordinary creatures about this. They're very threatened by giving away data. Some of the diseases like Huntington's, where there's maybe a hidden sensitivity about the illness, they'll be worried about, will this information reach insurance companies? And there's all sorts of reasons in history that people want to hold their data close to their heart. And I think the only way forward is to get them all round the table and again move from transparency to trust, and for society to be educated the benefit that getting this real world data back to the farmer is going to have an enormous effect on future generations.
Mary, you rightly point out that it's not necessarily the technical challenge in gathering the data, it's actually the personal challenge. And trust is absolutely necessary, but
Yes.
I see it as being very difficult for pharmaceutical companies, given the number of leaks, the number of issues that pharmaceutical companies have deliberately strayed outside of legality to convince the wider population that this is important. So what can a pharmaceutical company do right now to start building on that trust argument that actually has a chance of success?
I think they've got to deliver a good solution quickly, a win-win for both the company asking for the information and the patient group that will be giving it. If that can be sort of held up as good practice with a very clear message that this achievement has been done by working together based on trust, I think that will give a good example of how the job should be done.